Deep in the new state budget, there's money for 5 new inspectors for the Texas State Board of Pharmacy. They're part of a push to keep a closer eye on the growing number of compounding pharmacies and ensure the medicines they mix are safe. Every gram, every ounce is measured with precise care. Pharmacists at the Dripping Springs Compounding Center mix each prescription with one patient in mind.
Everybody's body's different and you react differently to different things. So I think the compounding is really the way to go. It's specifically made for the individual.
Nancy Nyland turned to compounding when her 14-year-old cat, Buster, got very sick and would not take a pill.
I went to the compounding pharmacy here, and they compounded a triple fish liquid that I was able to give him in an eyedropper, and he loved it. And it literally saved his life.
The Food and Drug Administration is closely watching compounding pharmacies right now, especially those making big batches of drugs and shipping them to doctors, often across state lines. The Texas State Board of Pharmacy will soon inspect compounding centers more frequently with 5 new inspectors. They have 7 now. The scrutiny brought on last fall after a compounding center in Massachusetts sent thousands of contaminated doses of pain injections to about 24 states, and more than 50 Americans died from fungal meningitis.
These types of preparations are extremely critical because they're injected into the patient's bloodstream. So any kind of mishap can be fatal.
The Board of Pharmacy hopes to hire the new inspectors early next year, adding another layer to the effort to keep Texas families safe. Again, the Dripping Springs Pharmacy only fills individual prescriptions and is not one the FDA is targeting now. The FDA and State Board of Pharmacy did recently inspect a Cedar Park compounding facility that supplies medicine to People's Pharmacies here in Austin and other doctors. And you may look at those inspections online right now with this story at kxan.com. And looking in depth, the U.S. Senate is considering a bill to give the FDA more regulatory power over some compounding pharmacies, those that operate more like drug manufacturers. We're talking about those compounders that make the drugs without a prescription and then sell them across state lines. The bill would require they register with the FDA and be ready for regular inspections. And the U.S. House is looking at a similar bill.